Everyone. Some of you were asking questions in the group, so I'm glad that at least some of you might have opened the document. Uh, so, Yesterday we have heard from Dr. Jayaprakash that today's session on communication, it starts from foundation course in MBBS, that is before they start their the first sessions on MBBS school, foundation course till the internship. So it is spread over all the years. So the modules which have been shared in the group is that module one is for foundation course, two is for first year, three is for second year, four is for final year, and fifth role plays for internships. So you might have received the trainer's guide. By the end of today, we'll be sharing all the presentations with you, which you can use when you teach anywhere. But it is created in for medical students, but I hope that will be useful if you are involved in teaching. And the PowerPoints will have the words under each slide. So when you see a slide, it will be written what to say in that slide. For example, if you want to do a buzz group, that will be mentioned in the slide. And in the trainer's guide, you might have seen that we have mentioned some of the activities. For example, if I say in empathy, we have mentioned an activity through which you can use that teach particular topic. So whatever materials we are sharing, please feel free to use this, but please find time to go through each of the materials when you receive it. So welcome you all again for the third day of faculty development program. So today now we'll be splitting you into your small groups. We have assigned the groups and the topics yesterday. So I hope you are all familiar with what you're supposed to do. You will have 30 minutes in your small groups. So each group will have to discuss how effectively you are going to teach that particular topic assigned to you. So one group might have got introduction to communication. So you have to come up with ideas how best you can teach the students that particular topic. It can be, yesterday we heard a little bit about various teaching learning methods also. You have to choose a team leader quickly as soon as you are in the small group. Choose a leader who is going to note down the notes that is being discussed in the group and present it to the larger group. So one have to write down the notes, and please make sure that everyone talks. So make it like you keep a watch or something, give 3-4 minutes to each participant and make sure that every participant in your group have something to share with this group. No one should remain silent. So now we are splitting you into groups. You will get a notification. Please get into your breakout rooms as soon as you see it. See you after 30 minutes. We'll send a reminder before we stop the breakout rooms. I hope everyone had a time to or a chance to discuss that each topics assigned to you, that how you're going to or what are the techniques that you're going to implement when you teach these topics to medical students. So we'll be waiting to hear from you all. We have Dr. Reena joining in for discussion and sharing her experience probably in teaching these topics, and to learn from you also. We all learn from you also when you share your experience. So we'll start with group one, who will be presenting from group one, like what all you will be discussing. And the topic assigned to group one was empathy, how you're going to, or what are the teaching learning techniques, how you would do that in your institution. Group one.
Good afternoon, everyone.
Yes, Dr. Harishankar, please.
Ma'am, actually, from group one, there will be a joint presentation by me and Dr. Devashish. So I will just outline the plan of teaching, how we'll start teaching to the medical students. So the topic for our teaching is empathy to the medical students, and the first 10 minutes will be for the introduction of the topic. And in the introduction, we'll make familiar to the students the terminology, like what is empathy, what is the definition of empathy, what is empathy, and what is relation of these terminologies to the patient care, that is both the curative and the palliative care. And after that, we'll give two exercises. The first exercise that will be for 10 minutes, and another exercise, that is exercise 2, for almost 30 minutes, which is given in the training manual. And after that, we'll go for an assessment session in which we'll go for reflective writing of the students regarding their responses if they are in the situation of the patient in the scenarios which we will be describing. And also there will be 10 questions, MCQs based on Google form. The link will be shared to the students and the scores will be calculated after that. So this is the plan, and the exercises, the two exercises will be discussed in details by Dr. Devashish sir.
Hello.
Yes, sir.
So actually the first 10 minutes, we are dealing with the first year and second year students. They are not at all versed with the clinical scenarios. So they are mainly just like layman's term. They have just passed the 12 plus 12 and they entered into the MBBS curriculum. So they do not know what is empathy, what is sympathy, what is and their general knowledge is towards medical fraternity is only the curative intent. So the first 10 minutes will be what is curative intent management, what is palliative intent management, what are the patients for which palliative intent management will be given, what is life threatening disease, what is life limiting, and what is empathy and what is sympathy. Just brief descriptions in the first 10 minutes. And regarding empathy and sympathy, the very common example is that one person is fall in the deep hole, and one person who is sitting on the top is talking with communicate with the patient, with the person which is fall down, and that is, and how are you doing the rescue operations will be coming on. This is the sympathy. But if you come down to the patient and sit by side him and shares his feelings, that is sympathy. That's some one or two examples. This is for the first 10 minutes. Then the exercise that will be given for the first exercise, and regarding the exercise part, we intending to follow the rigorously the training module given, the teacher's guide module. But the problem is slightly different that will be put to the student. The first exercise will be like that. First, the student is going through the hectic session of 5 or 6 days, and on the Friday night, he or she is at the evening, he or she is enjoying the IPL or ISL match, and suddenly the phone comes from his neighboring elder brother or sister that his or her job has he suddenly fired from his or her job. And the background of the neighbor is that he is the only son. His father died 5 years ago, 7 years ago, and his mother is suffering from severe breast. And so though he's very talented, he cannot continue his study. And after passing 12 from by some vocational training, he is engaged in a private firm, and his job was suddenly terminated. Now he or she phone you that my job has done. Now what will be your response? Just write in a paper, and that will be for 10 minutes. How you will the student responds to it. And the second exercise, that is for the 30 minutes, that is we follow the guideline given in the module 1, that the 6-7 sheet of papers has been placed by the patient, and one case scenario is explained by the trainer like this for the other participants, that One person, he is suffering from epigastric pain, for which H2 blocker is given for off and on, and it has of late the pain does not subside. Then patient went to his general physician. The physician advised ultrasound. Ultrasound does not is non-contributory. Then after again 1 or 2 months, as the pain again increases, he advised CT scan, and the CT scan shows there is a SOL in the abdomen, and for which the patient is put for endoscopic biopsy. After a traumatic phase of endoscopic biopsy, the results come out after 7 days, and it comes out to be a CA stomach. Now, before this, the trainer instruct the student that you write your aim or your dream, six or 5 or 6 dreams according to your preference on the paper, each and every student. Now, then you describe this case scenario. Now, after the diagnosis of the CA stomach has come out, then ask the student that which aim or dreams that you have been put forward, or you have already written 6 separate pages, which one is not so important at this moment. You just set aside this one. Then the patient is put for surgery. The surgery was done, and after the surgery in the recovery room, the patient asked the attending doctor how the surgery went. Then the doctor said that on opening the abdomen, it has been found that the cancer has spread all over the abdomen, so we cannot operate. We just suture it out. And on hearing the news that this cancer is not in the localized form, the patient is traumatized. Now, at this moment, which part of the aim or writing that is not relevant for the patient, you think, you set aside that part, that question, that piece of paper. Then the next third phase, patient was on chemotherapy, and it went well for first 1 or 2 or 3 sessions. Then the effect of chemotherapy comes out that there is hematological abnormality, there is weight loss, patient has severe vomiting, and patient has cachectic loop, he has anorexia, and there is falling of hair. And at that point, when patient looks at the mirror, he sees himself as a deserted man. And at that moment, which part of the aim or your dream cannot be fulfilled, you set aside that paper. And after that, on progression, patient has low back pain, and patient was taken to the hospital by his relatives, and on regaining consciousness, it has been found that it has spread to the there is spinal metastasis, and patient is suffering from paraplegia, and there is loss of control of bladder and bowel, and attendant will do the rest. So the patient is shattered more, and at that point you ask the student that which part is of the aim cannot be possible to fulfill by the patient. You set it aside this. So in this way, ultimately, which that part or that aim which is still present, that means you think that even at this stage of this patient, let's see a stomach with metastasis, the patient can fulfill his dream of that part. And whether if along with it, now the exercise 3 is that if you put yourself into the shoes of the patient, that in case you are the patient and you goes through these stages, whether the exercises or the actions that you have taken just in the previous 20 or 25 minutes, if you are the patient, do you do the same? If you do the same, that means it is the actual empathy, because you are cognitively and emotionally as well as compassionately, you goes into the patient's mind. And that is the exercise 3. And ultimately, then the last 10 minutes, you reflective writing, as Dr. Shah has said, and along with the MCQs, the 10 MCQs.
Thank you, Dr. Devashish. Ma'am, we can take your comments before going to the next group.
Sure. Thank you for what you have shared and for the importance that you've given to this topic and the thought that went into it. Just a couple of questions occurred to me. First, are we thinking of something in the cognitive domain or the knowledge domain, the skills domain, or the attitudinal domain?
I think it is the attitudinal domain.
Yeah, it's in the attitudinal domain and it's first year students. So since it's in the attitudinal domain, maybe I would feel that, you know, knowing the definitions and answering MCQ assessments may not be as important as absorbing something and maybe, if need be, slightly altering their way of thinking. Would you agree?
Yes, ma'am. Definitely.
So, so towards that, I think the case scenarios are a good idea. Though perhaps for a first year student, you know, the inoperable cancer case scenario might be a little complicated. So could we instead choose a scenario? The job losing scenario is a little more what they might understand. So could we choose a medical scenario which, you know, they may have seen somebody has a fracture or something like that. And one way maybe to do a bad role play. I would not ask the students to do the bad role play because they'll be very good at doing bad role plays because they all like to do drama and that is what they'll remember. But if we show them a bad role play and then we ask them to present a good role play to demonstrate empathy, that may be one possibility. What do you think?
Yeah.
And
More
then,
acceptable.
and then of course one can have the reflective writing or a Google form after that. So I think the key suggestions I made was that in an attitudinal domain, thank you. The assessment by our usual formats may not work. At a senior stage, we can do an OSCE assessment, but not at this stage. And something that they do may be something they may remember better. And actually, in fact, empathy is probably more in first year than in final year. So these first year students might actually do quite empathetic role plays. Dr. Sreedevi, any other comments from your side?
No, ma'am, no, nothing from my side. Ma'am, can we move on to the second group?
Yes, please.
Group
yeah.
2, who will be presenting.
And if others have comments, they can put it into the chat box.
Yes, chat. I thought, sorry, I forgot to tell that. Because there might be people who are already teaching this in their institution. Some of them are the
Yes.
preclinical department also. So please put in your
Yes.
experience. If you have taught this particular topic, how did you teach and what were the good things and bad things, so that when we teach, we can modify our teaching according to your experience also. Please share that experience with us in the chat. Well, we'll move on to group 2.
Good afternoon. I'm Dr. Kalindi, and I'll be representing the views of group 2. So everybody in the group agrees that when we go to take a lecture, first of all, we should introduce ourselves, and we should give a brief introduction to palliative care. After that, we can a very brief introduction. I mean, what is palliative care? Then we can have an interaction with them about communication, and we can tell them what is communication and have their views also in this regard, what they feel is communication, what are the different types of communication. And then after that, having like brief introduction to communication, we can divide them into 2 groups to do a role play about bad communication and good communication. For example, if like whatever groups are doing good communication, remaining of the members in the group can enumerate the reasons why it is a good communication when they are doing a role play. Or we can ask the opposite group to enumerate why it is a good communication. Similarly, when one group is doing a role play on bad communication, the other group can enumerate the reasons why it is a bad communication. At the end of it, we can show them video clips about good communication and bad communication. This can be followed by a PPT presentation in which we can summarize what are the different types of communication, components of good communication, what contributes to bad communication or barriers to communication. And if time permits, after this PPT presentation, either we can bring in a patient or we can give them a case scenario to the students. And then we can ask them randomly or roll number wise what they would do in this particular case situation, how they would interact with the patient, how they would approach the patient, what all they will say to the patient, and what all things are to be avoided in a structured format. Finally, we can summarize and we can do a post-test also for these patients. We can put very simple questions and we can try to get an feedback how much they have understood and also to reinforce whatever has been taught during the class.
Thank you, Dr. Kalindi. Anyone else would like to comment on this plan before we ask Dr. Reena?
I forgot to add one more thing. One of our group members also suggested that we can ask them if anybody has any such personal experiences in the class. During the interactive session, we can ask them to talk about these personal experiences.
Yeah, that's a very good point, Dr. Kalindi. Ma'am?
Yes, I think thank you for that. There were many learning by doing suggestions there, which are very good, including sharing of personal experiences and role plays with the rest of the group, commenting on the role play, and also the post-test at the end, the summary at the end. Maybe the only suggestion I might make is that don't, I would not invest too much time in getting students to do the bad role plays. you can play a video of that, or you can do a demonstration, because we want them to learn how to do the good one. And bad ones are always easy to do, and usually that will be more dramatic and everybody will laugh more, and so they will go away with the wrong memories. So we can show a bad one in our video or in our demonstration, but let them all do good ones. And when you are asking the one group to observe the other group, you can even split it up. You can ask a few people to look at what is good in the non-verbal, a few people to look at what is bad in the non-verbal, a few people, or what can be improved in the non-verbal, a few people to look at what is good in the verbal, and a few people to suggest what could be improved in the verbal. And so everybody is actively looking for something, and when you debrief them, you can even ask individuals, okay, you were supposed to look at this, what did you notice? So that it's not just one or two people who are involved. Yes, so thank you for that. Yeah.
Thank you,
Thank
ma'am,
you, ma'am.
Dr. Kalindi. I would like to, the one challenge that I would be thinking is to get these students to do the role play, because they'll be a little worried about, like, others are looking at us and commenting. So you have to prepare them when you invite them for the role play, because they'll be little worried about what the peers, will they tease me, or are they going to judge me? So just prepare them. What do you mean by a role play? How are you going to do it? They are not criticizing you as a person. Probably it's a learning experience or something. One other point I was thinking, when you mentioned the introduction part, maybe I may not bring in the palliative care there, because then there is a chance that, okay, this is something to do with palliative care, but this has something to do with every aspect that they do throughout their education or throughout their patient care. So it's nothing wrong in talking about, maybe there is another view to it, but I was thinking, do we actually need to introduce palliative care there or not? I'm just thinking loudly. I mean, anyone can comment on that.
Yes, ma'am. It is very well presented by Dr. Kalindi. But when I am teaching the students of MBBS or any group like nurses or technician group, then I feel that to awake the children, first stand one of them and say to them, ki, aap padho, and give the case scenario and ask the students what are the problem in this case scenario, one by one. So they will be awakened and ask the solution, whatever you have teach them in the last, ask the solution of that problem. So you may involve all the students with that case scenario. This will be very helpful. This is my experience in teaching.
Thank you, Dr. Sarita. I think in the end, they are planning to do a case scenario, right? Dr. Kalindi
Yes.
was mentioning they are planning to give a case scenario and ask students that how do they plan to respond and everything.
Yes, ma'am. Yes,
I think I should thank Dr. Sreedevi for bringing up the point. Before the students do the good role play, it would be good if they have seen you do a demonstration role play and they're doing it in a different scenario. So you show a bad and you show a good version of it, and ask them to notice what is good and bad, and then ask them to do the good. Otherwise, it can be quite threatening. And Dr. Sarita, I agree with you about the case scenario, because that helps them get engaged and problem solve.
Dr. Jalaj, you had a question?
So actually, I had one suggestion, but you have already raised that point. One thing that I can add, even at that point, even at this point of time, that rather than being asking our students to play that either bad role or good role, the doctor or the teacher should himself or herself should take that responsibility that I am presenting this particular scenario and I am the patient here. Now you, being a doctor, just tell me how you will react in that situation. Now I will be the good patient or the bad patient or the very bad patient. Now I will observe how my students are going to address that particular scenario or particular situation. So here I'm not asking my students to act in a bad manner. I will take that responsibility on my own to enact in bad also. But you have already raised that point, so nothing in discussing that much.
Thank you, Dr. Jalaj, for your comment. Next group, group 3. Who will be presenting from group 3? Do I need to check names?
Yes, ma'am.
Yes, Dr. Neelaji, please.
So our topic is managing emotions. So first of all, I want to divide the topic to teach the students into 6 into 10 minutes. First 10 minutes is introduction. So introduction about emotion management. So what is the importance of managing the emotions? So early detection and treatment of any morbidity can influence the good psychological outcome, good affective state, the coping style of the patient with the disease scenario, and the treatment compliance in the quality of the life. Now the treatment part, the importance of counseling and education to the patient. If needed, any psychotherapy, any psychotropic medications, support from the family member, and how can we help the patient or family member which are to come in terms. Importance of good communication with the patient and the family, mentoring hope in a realistic way, setting realistic goals, scheduling some activities, helping the family members, getting an atmosphere where the threat of dying or death may freely expressed by the patient, and some preventive measures could be taken, and also the counseling from the very beginning, that will be one of the diagnosis during the treatment. The supportive care through the different phases of diagnosis, treatment. If there is any failure of treatment or recurrence of the disease during the disease progression or during the terminal stage. So this is my introduction part. Then 2 exercises can be given to the students for 2 into 10 minutes. First exercise is based on that's our group is suggested that 65 years old male patient diagnosed with pancreatic cancer. Patient is unknown about the disease. The party is aware of the disease. The patient has also morbidities like ischemic heart disease and diabetes mellitus. How we manage or tell the truth to the patient, and how we manage if the patient is burst out with his emotion. This is the first exercise we can give to the students. And the second exercise we can give to the students is like that. The patient of adolescent patients of 18 years old who is unaware about the disease, but his father know the disease, and patient is suffered from G junction malignancy. Patient is unable to swallow food and frequent vomiting, and patient is unaware about the disease. How we can approach to the patient in front of the father. This is 2 case scenario we can give to the students. Then after giving the 2 case scenario, we can take assessment. First assessment is based on this based on these 2 exercises given to the patients. Excuse me.
Sorry, there was a
Second
background noise. You can please continue.
Second assessment is based on the based on some writing some scenario by themselves, if there is any queries regarding them, and to writing some answers of the questions that were previously prepared. And final 10 minutes is for any questions from their side, and how we can approach with them, how they can approach with these questions like that. This is all about 60 minutes. In 60 minutes, we can spare for the patients.
Thank you, Dr. Niladri. Anyone would like to add to that what Group 3 has shared? Ma'am?
Thank you, Dr. Niladri. And again, I think I especially liked what you said about, in the end, giving them, asking them to make a little scenario. Maybe what a simpler way to do it, maybe to give them a scenario and ask them to write a response to that. And that could come very close to the end of the session. Regarding managing emotions, one important point that we need to stress is allowing silence. Okay, so when you give bad news, to wait for a little while so that there is time for the patient to express that emotion. Because sometimes we go ahead like an express train. So that is one point. And the second point, again, here actually teaching videos can play a very good role. And especially if you can get teaching videos from the Indian context, then you can ask them to note down what are the emotions being expressed verbally and non-verbally, and what are the helpful and the unhelpful responses in the video. Because especially with videos, you have the advantage that you can, pause it, and then people can see the non-verbal and the verbal. You can also pause it and say, okay, the patient has responded like this, what should the doctor say? And you can get different responses from the group, and then play the video and see what the doctor actually says. And the task that you suggested, no, that they do their own scenario or write their own response, it could be you could keep that right for the end, after the question answer session also. Because in the question answer session, they may learn things, they may clarify doubts and misconceptions. And this final thing can serve both as an exercise and as an assessment and as an attendance, all of those. So thank you for that.
Any other comments from other group members? Anyone who has done this particular topic in their institution? Or any other ideas that you have? So in the, we will be sharing more materials today. In that, we have given link to some of the videos on good communication, bad communication in an Indian scenario when created by us. Please feel free to use those videos. Short videos, these are all 3 minutes videos, one on good and one on bad. And in the communication video, there are some emotions which are coming up, like the wife talking about her distress and the patient talking about his distress. So how the person has responded. So it's not typically doctor-patient communication. It's something which we shot based on a community when someone is going to their home. So it can be used for the first year medical students also. They don't need to be thinking like only a doctor should behave that in a particular way. So please feel free to use those videos. We have given the YouTube link to those videos. Group 4.
Hello, ma'am. Ma'am, I shall be presenting on the behalf of my group 4.
Yes, Dr. Shivani, please go ahead.
Actually, I have prepared a PPT. Could you please project that for me? I'll share that in the WhatsApp group.
Or we'll just give you the sharing rights now.
So actually, I have prepared that on the laptop and I have logged in from my phone. So that won't be
Please send
possible.
it to WhatsApp. No problem. We'll share it from our side.
Yeah, it's done.
Yes, we'll do that in a minute. Yes, please.
Yeah. Yeah, so actually the topic which we want to discuss with our students is collusion. So the learning objective of this session would be, so we will just give the learning objective to the students, what is expected out of them at the end of this learning class. So they would be mainly the observers or the students are the phase 2 students. So at the end of the activity, the phase 2 student must be able to explain what is collusion correctly. And they must be able to describe the ability to build a rapport with the family towards the objective of managing collusion, and also to describe the skills used in attempting to break collusion. So these would be the learning objective, what the student must achieve at the end of this session. So first we give a brief introduction about what is collusion and what is the scenario of this. So collusion is defined as consultation where information was withheld from the patient primarily at the request of family members. So just giving a brief scenario of the problem of collusion, how much it is. So that for that we can quote the study which is already published in postgraduate medical journal from Dr. Deba and their colleagues, in which they have studied the prevalence of collusion during their consultation with patients being seen in their palliative care clinic. So, and during their study, it was observed that the palliative care clinic, the patients who were diagnosed with some rare diseases or life-threatening diseases, only 18% of them they know the actual diagnosis, and the collusion regarding diagnosis or prognosis was present in 40% of the cases. So we'll define the problem which is there in the collusion. Next, please. And after this, after giving the introduction about collusion, we can show them the video regarding the handling of the collusion, the actual video, which is the link has been shared here. Next, please. And then we can give them a little points to remember regarding what is collusion, how they can handle the collusion, a brief crux from the video which has been shown to them already. Next. So these are the things which they must remember at the end of this session. Next, please. So these are all the points which they must remember regarding the collusion, how they have to express the empathy. Next, please. So they must understand the patient's perspective and the personality of the patient. So these are all the points which have been highlighted in the video already. And then they just need to remember these or as a take-home message. Next. So this is a very important component among collusion, that allowing silence, which is active listening during the interaction with the family members of the patient. So this is again a component of the interaction between the family members and the doctor himself. So we need to reframe the situation. Next, please. Next, please. Yeah. And then the doctor need to give the support to the family member, how they will break this problem to the patients in a stepwise manner. So these are the things which the students must keep in mind. So then we can give the study material or the reference of the study material, which the students can go back and they can study to actually understand the problem of collusion and how to go about it, how there is a doctor-patient communication, how they can incorporate good things in their communication when they are dealing with the patient and their relatives. So we give them study material. Next. Yeah, and then comes the group dynamics part. So we will divide the student among different groups and we will give them different case scenarios. And then they will have to do the role play according to different scenarios which have been given to them. Next, please. Yeah, continue to the next slide, please. Yeah. So at the end of the role play session, we can always chip in the feedback to the students. So what they have achieved in the role play and what could be the things which can be added to make it a better communication. And next, please. In the end, yeah, in the end, we need to give them the method in which they will be assessed for this role play. So we can tell them that they will be assessed on the basis of case scenario only, and they will be given a checklist of the points of communication which they must interact with the family member. And then an observer will be there who will be checking whether the student has taken all the checklist points into consideration or not, and then they will be evaluated accordingly. So they will already have the checklist. They will have to follow that checklist for the communication part, and then they will be evaluated if they have followed the checklist or not. So that would be the assessment method given to the students. Yeah, thank you.
Thank you, Dr. Shivani. Due to lack of time, I'm directly going to Dr. Reena. But just a few thoughts. I think there should be something to create that interest. Why should I learn collusion? Why should I learn about collusion? What is my business in collusion? So I think it should start with something to trigger the need or interest, that it can be a trigger video, or someone can share a real experience that they had, or some scenario, so that they should have an interest in learning. This is not any other theory topic that they're going to learn, but something to generate that interest among students. Otherwise, they'll feel this is why should I learn all this? Anyway, this is not going to be asked for the exam. So what is my role in learning this? So from that, Dr. Reena.
Yeah, thank you. I think we saw many nice principles of medical education there. You know, you had written the learning objectives, the teaching methods, the assessment methods very nicely. And it is also a very difficult topic. Like Dr. Sreedevi said, like the initial trigger could be something like somebody who says, you know, but I sold everything because I thought I was going to be cured. If I had known that wasn't the case, then I would have done differently. So then that brings in the importance that, you know, that is one example of a trigger. And in this instance, we do need the definition and the knowledge domain, because it's a term people are not familiar with. So I think it's a good learning objective to have the definition there and to have the videos. You also reference literature, which is good, with some valuable information from literature. Now, of course, right now time was short, but in general, it'll be good on each slide to put the reference from which a particular information is given. And just a small point about the collusion study from our hospital, 18% did not know the diagnosis. It's not 18% knew the diagnosis, 18% did not know the diagnosis. It was the other way around. And the fourth thing is about, again, matching the level of the learner to the complexity of the topic. So I think what you suggested about the OSCE and the checklist for the student assessment, that's very, very important. But perhaps for the phase 2 MBBS, I would keep that for something like breaking bad news rather than for collusion. Because with collusion, I think I would also tell them that this is one of the things which does not always get resolved, and especially when it is long-standing collusion, there is a higher risk that it may not be resolved. So we have to be willing to accept that and give it time. Because sometimes when people become over enthusiastic that I have to break collusion today, they can end up causing a lot of distress and anger. So therefore, if you want to actually do an assessment related to collusion, one way may be to again play the videos and ask them to notice what were good things and bad things that the doctor did when faced with collusion. This would not be a topic I would ask a phase 2 student to practically do an OSCE. But exactly all that you said could definitely be applied to a breaking bad news teaching. I think there we do need to do OSCEs. What do you feel, Dr. Sreedevi?
Ma'am, I think Dr. Shadrupa has something to say.
Yes.
Ma'am, I want to add something that before going to discuss the topic, we must ask the students what they should do in this scenario. Then we can switch on the video so that what are the difference between they already know and what should we do in the practical purpose, then they better can learn from them.
Yes, that's a very important point, because again that generates their interest, and fully agree.
Yeah, ma'am. I also want to say something. Collusion is to break collusion is very difficult even in educated family also. We are facing a lot. So for the students, I want to say that for creating interest, we can tell them that what is the benefit of breaking the collusion and what is the harmful aspects of the breaking for the collusion. So they will take interest. When we are not able to break the collusion, patients and family did not know the future of the disease, and they do not did any work or what they want to do in so when they will listen this is the harmful aspect of the collusion, so definitely they will take interest to break the collusion for the students.
Yes, that is important. And also the point that was presented, one learning objective was how to build rapport. That's a very important point, and that is something which even the second phase student can learn. So things like acknowledging their point of view, asking them why they feel they should not tell the patient. That element of building the rapport, even the phase 2 student can definitely learn. And yes, thank you.
Thank you. And I think a quick point is that even if you are unable to go to a phase 2 student, I mean, some of you are in radiation oncology, if you are not involved in teaching, when they are coming to you for clinical postings later in their education, probably they might be seeing a lot of patients with collusion as a scenario. So you can actually role play yourself, like you can actually demonstrate, or after the patient is gone, you can ask them, what do you think about this? So they might be coming in small groups. We are not doing a big group teaching. So I just think that it should not stop with the classroom teaching. Whenever they are coming to your clinical exposure, and if now there is a early clinical exposure program, so that time you can show them actually how devastating it is when someone doesn't know about the diagnosis. Just a quick point too, because the teaching doesn't stop there when they come to you, or if you're not involved in the teaching, that's fine. When they come to your clinic, you can actually demonstrate and tell them this is how it is. Quickly to group 5, the last group.
Good evening. I'll be on behalf of my team presenting. The topic is breaking bad news. And this will be actually given to the phase 3 students. It is in module 3. It is 3.123. It comes in that group. So it is actually the job is little easier because whenever we want to tell about breaking the bad news, so many things will be a part of it, like empathy we have to keep in mind, we have to tell it, the communication part. So most of the communication part would have been started in your phase 1 and 2. So now the job is to know the finer details of how exactly to present the breaking the bad news. So as other group people have actually told many other methods. So in my session, in the session 1, we have 2 sessions. Definitely we will introduce the topic for them, for the whole class. Then next we'll play a video, and here usually we get a video of the other countries or which is not localized. So as according to my plan, maybe in our whole hospital, if feasible, or maybe the some locality, if some doctors are there, and we record those and we present, so that the impact on the students will be better than, because they will learn more from their own teachers compared to others. So the video will be played to the whole class. After playing the video, so we might actually ask them some of the doubts or whatever they want to do, because the later after this we divide them to do we give them instructions. So we have to do role play. So before that, actually they would have got many doubts. So we will clear them in the class. Then we actually divide them into groups. Like if it's a class of 110 people in a group, actually 10 people is more in a group, but better, but because of the feasibility of the time, like time is not up to mark, so we can increase. Then here we do a role play. Actually I had done for good and bad. As ma'am told, we shouldn't make them do bad, so definitely we will include that. So we will only tell them to do whichever is possible for them. Then in the groups we give case scenarios of the same, like different diseases, because the same thing will not be monotonous to them. So the case scenario of anything like breaking bad news related to many diseases, like maybe cancer. See, cancer is different where they know their mindset is already there. And one more thing, maybe some accidents, road traffic accidents, and the younger people, older people, there are different empathy and different type of reaction changes. A kid, maybe 5 years old. So these scenarios we keep them. So the reaction from the patient will be different in each scenarios, I feel. So those things should be added to them. And after that, we divide the group and we give a mentor, because we have staff are there and PGs are there. So we give, so and that's a time also. So the next week will be the second session. So we make them in a group and we give one mentor also for them, so that they do the role play according to the case scenarios. And they will, if anything is there, they can ask their modulator like what to change, what not to change. And definitely at the second session, we have only limited time where everybody, if they're asking us the questions, cannot do every group if possibly. So whoever, like however it's feasible, we do. We tell them like everybody should be ready. So whoever is done, we can give. Then while presentation, we tell other group people to observe. Then we give time to them. Then we assess simultaneously. The mentors will they have a technique like Kalamazoo technique. So each thing is there. How do they communicate? What part? So everything we take and we assess. The mentors will be assessing, and the other group people will be observing them. Finally, after each group, we'll take more time and we ask we ask from the audience, like students, what was the thing which was lacking or which could be better, because we have already shown a good video of however the performance should be done. Then our mentors also, according to the observation, whichever is lacking will be told to them and finalized. So we can do 2 to 3 groups possibly. If it is feasible, we can do it. Then finally, we'll give a role like a video. Again, we can put a video of related to it, and we can ask their opinions or questions. And this has to be definitely reinforced when they are in the internship, or maybe because they'll be in the third phase. Simultaneously, the next day they would have gone to the wards for other case taking, or they would have seen surgery case, any case which is bad. So there we will ask them to apply, and if possible make a video or whatever, if possible do, and come back to us in the next session.
Yes.
Ma'am,
So thank you. And again, I mean, I think one important principle that you stressed was repetition in different contexts. That I think that is quite important. And now, unlike collusion, this is almost like something where they should be able to must do, not just must know, but must be able to perform. And so again, I think in the introductory session, it's good to have the learning objectives put down, that they can list the 6 steps of breaking bad news. They can demonstrate these things. So that is one element. And the second element is you could also give them the task of, as they go through their clinical posting, to note down a few examples where they saw of good breaking bad news. So then they're actually seeing that happening in real life. If you want, you can have an optional thing where students are asked to make a video, a role play video. And so that they will enjoy of good breaking bad news. I think 2 things which are in common to all these topics of communication. One is to again and again stress listening. Okay? That the first step in all of these things, breaking bad news, managing emotions, collusion, is listening. And that is something from phase 1, we can bring that in. And a second thing which is applicable across the board is to tell them that as they go through the years, to notice good and bad examples and see how they will apply it to their own. So then it doesn't just remain just in a few classes.
Thank you, ma'am. Any quick comments from others? I know we overshot time, but I learned a lot. It's just very useful when you come back and tell us your plans, because as you said, we also will learn and we can also share our thoughts with you. So if there are quick comments, we can take that, or else we can wind up and talk about tomorrow's topics and session. Thank you so much, ma'am, for joining us one more day.
Thank you.
Your schedule. Thank you so much for sharing your experience also.
Thank you. And all the best to all of you. We really look forward to hearing about your, implementation. Thank you.
Thank you, ma'am. Thank you all the participants for the discussion. Please, some of you were busy with your work during the group discussion. Please make yourself free for some time so that we can all discuss and come up with a plan. It's just a short time, just 5 days. So please be with us during that group discussion and please contribute as much as possible. I'll quickly take you through the available resources so that you get an idea. If I send it, you might be confused what is where. So I'll just quickly show you. For tomorrow's topic, it is pain. I'll send the topics for each group in the WhatsApp group, but I'll show you how or what all materials are there in the folder that we are planning to share with you. Just give me a moment so that it's easy for you to understand. So we'll be sharing 4 modules. So module 1 is for first year MBBS, module 2 is for second year, 3 for third year, and 4 for final year. So for example, if I say module 1 is generally taught by the physiology department. So when you open the module 1, you can see a PPT on pain pathophysiology and assessment, and you can see case-based discussions on total pain and a module on trainer's guide. And if you want to conduct a pre-test before the session, we have questions for pre-test also. It is ready to use. If you're planning to take a session for first MB students during the physiology hour, you can just open this and everything is available in this. Just go through it once before you start using it. And if you open the trainer's guide, I'm sure at least some of you, can you open the trainer's guide? Yeah. Some of you might have, at least some of you have gone through the trainer's guide, which I understood when you presented. So this will have a learning objective, which MB students that you are teaching, under which domain it comes, whether it is must know or know, or should know how and show how. And the objectives is very clear by the end of the session. What are they supposed to learn? So this is how the trainer's guide looks like if you have not opened it. But many of you have gone through it, I'm sure. You can close it. So we have given role plays in that. So if you want to take session, just open this folder. If you're going for the first year, you will have everything available. Again, if you go back, you can see same thing with the module 2. Module 2 is for second year. Basically, it will be more on pharmacology. So second year, when they come to pharmacology, you can use this, where there is, we have taught about the pain management, where we talk about NSAIDs and opioids, correction prescription activity. So you can give a few prescriptions and you can tell them to correct those prescriptions. And there are a few references, NCG pain guide, NCC and pain guidelines. If you yourself want to refer, everything will have a pre-test. If you want to conduct a pre-test, the pre-test questions are made by the experts. It is also available with every module. So likewise, we will be sharing all the topics. This is a folder for pain. It has 4 modules from first year to 4th year. So your group will be given task immediately after the session. This will be shared as soon as possible. So the communication modules will also look similar. Foundation course, first year, second year, third year, and internship. Once you open the folder, you will get the PPTs, the questions, the assessment, and videos, links, references, everything will be in the module 1 folder. I hope that's a little clear. Unless you open it, you won't get an idea. That's why I thought I'll show and tell how it looks when you open. And first day, the session 1, we have shared, if you go through the learning material, we have shared an Excel sheet, which all topics are covered in which all years. So year 1, what all topics can be taught, year 2, what all topics can be taught. So that is shared already in the IECO. So whenever you have time, please get an idea about how you are able to deliver these sessions. Thank you so much. Not taking more time. If you have any more questions, please communicate through the WhatsApp group. And we are sharing plenty of resource materials with you. Please feel free to use it and let us know. We really want you to go and go back to your institutions and start teaching to the MBBS students as much as possible. Thank you so much. See you tomorrow.